I'm Dr. Rodney Davis from the Department of Urology. I am the chair of the Department of Urology here at UAMS. The symptoms of an enlarged prostate usually at the earliest will usually start in the 40s, but it is most common in men who are in their 60s and 70s. The most common symptoms associated with an enlarged prostate are frequency of urination, some slow stream, feeling of incomplete emptying, getting up frequently at night. Now there also can be other causes for getting up frequently at night, but that can also be a symptom of residual urine in the bladder, so that the capacity of the bladder is reduced by the fact that you're carrying residual urine in the bladder. And then the most dramatic symptom is what we would say is acute urinary retention. You're unable to void at all. That usually is significant enough that it takes you to the emergency room. There are other symptoms, other conditions that can also be associated with these slowing of the urinary stream. And one is urethral stricture disease, this is scarring in the urethra. But that is less common than the enlarged prostate. Now, you can have prostatic symptoms with a normal sized prostate, but you can also have them with an enlarged prostate. And so the symptom complex we treat in multiple ways. The first treatment is usually medical management, and that is to give drugs that will relax the muscle within the prostate, so that when you have the urge to go and your bladder contracts, that the relaxation of the tissue at the neck of the bladder will allow the urine to flow more freely. The second medication we use is, a lot of times there are two components to an enlarged prostate. One is the tightening of the muscles, for which we use the first drug I mentioned. And the second is a static component, that's the bulk. So as the prostate becomes larger, it becomes bulky. So we reduce the bulk. We use a medication that will shrink the prostate. So we'll use those in combination and as the first treatment. If this does not work, then the next step would be to remove a portion of the prostate. And we have several ways to do that. We have a conventional way where we use an electric cautery that will remove portions of the prostate, and then those portions are then disposed of. The second way we have is just vaporization of the prostate. We can use a laser that will actually vaporize the prostate. And sometimes they are so large that we actually have to make an incision to remove a portion of the benign prostatic tissue. The reason that I'm here is my patients, and being able to actually help them understand their disease process, care for their disease process, and also to comfort them. I often tell my patients, the day you come in, we become one.